How to properly treat depression by Dr. Richard Zhao.
As an outstanding representative of Chinese civilization, traditional Chinese medicine has gradually formed and continuously enriched the development of Chinese people of all ethnic groups in thousands of years of production and life practice and the fight against diseases. It has not only made outstanding contributions to the prosperity of the Chinese nation, but also has a positive impact on the progress of world civilization. In the process of historical development, traditional Chinese medicine is inclusive, innovative and open, forming a unique concept of life, health, disease, prevention, and control, realizing the integration and unity of natural sciences and humanities, and containing the profound philosophical thoughts of the Chinese nation. With the change of people's health concepts and medical models, traditional Chinese medicine has more and more unique value. Pay attention to the whole. Traditional Chinese medicine believes that man and nature, man and society are interrelated and inseparable unity, and the human body is also an organic whole. Pay attention to the impact of the natural environment and social environment on health and disease. Believe that spirit and body are inseparable. Emphasize the synergy between physiology and psychology. And pay attention to the interaction between physiology and psychology in health and disease. Traditional Chinese medicine believes that the 7 emotional changes of joy, anger, worry, thinking, sadness, fear and panic are not only the external manifestations of human mental activities, but also closely related to the visceral function of the human body and the operation of qi and blood. If the heart is happy, the liver is angry, the lungs are sad, the spleen is worried, and the kidney is panicked. Excessive emotions will damage the function of visceral abdominal qi and blood, and abnormal visceral function will also affect emotional fluctuations. Traditional Chinese medicine not only emphasizes the treatment of diseases, but also emphasizes the prevention of diseases. For the prevention and treatment of depression, traditional Chinese medicine attaches great importance to spiritual health care. It pays attention to tranquility and nihilism, spiritual internal guard, focusing on deep breathing, reducing their excessive material needs, cultivating their own good psychological qualities such as benevolence, tolerance and generosity, and eliminating negative emotions such as jealousy, anger, hatred, pessimism, fear, laziness, etc. Both traditional Chinese medicine and Western medicine believe that the brain and spinal cord are most commonly formed in the growth and development of fertilized eggs, which is one of the most important parts of life. After the brain marrow is formed, the embryo quickly forms its own blood vessels and heart, and begins to have blood circulation in it. Of course, it also forms a relatively independent umbilical meridian and placenta, which are closely related to the mother, constantly inhales the mother's shadow into her body to maintain the continuous growth of her soul and body. Love is the most important medicine to treat diseases. If you keep love in your heart, love mum, dad, lovers, brothers and sisters, friends and neighbors, then our world will be more wonderful and our lives will be better.
A healthy and happy baby needs mom's good blood.
Pregnant mothers should eat some nutritious and balanced eggs, fish food, and also eat a variety of fruits, vegetables, starch and fat.
Do not smoking. Do not drink alcohol. Do not do the extreme exercise. Keep a happy feeling is very important for a happy baby.
When a baby is inside its mother's womb, there is an incredible bond that begins to form right from the start. A mother and growing baby share nutrients through an umbilical cord, but another thing they share is her emotional well-being. A baby in the womb can feel its mother's emotions too. When a woman feels positive emotions, like feeling loved, being affectionate, feeling optimistic or cheerful, it affects her baby in a good way. When she feels the negative emotions, it can have a not so great effect on her baby. Warning: if the child falls head down, most of them will not cause too much damage, just scratch the scalp and damage the skin. However, we must be careful, because it can also hurt the cervical spine, cause cervical stiffness, pain, cervical spine dislocation, etc. In serious cases, it may also affect the vertebral artery, cause insufficient blood supply to the cerebral basal and brain stem, thus affecting children's ability to deal with emotions and causing depression in future life.
From this image, we can see the first vertebra is moved up towards to the occiput bone. And from this image, we can see the first vertebra is moving down towards to the second vertebra. These two images show how the arteries close to the C1, C2 vertebra. From this image, we can see a sudden movement of the first and second vertebra can cause artery damages.
Now everyone should understand that mental health depends entirely on a healthy brain. Mental activity covers almost the whole brain. He first began with what we saw, heard, touched, and sometimes even thought of and guessed. This information first spread to the brain stem, then to the thalamus, hypothalamus, basal nerve nucleus, such as almond nucleus and other low-level centers. There is a strong emotional reaction. If some of the danger comes, the risk response mechanism is immediately activated, the sympathetic nerve is excited, and the pituitary gland is commanded by the adrenal gland secretes adrenaline to prepare for fighting or escape. Others upload information to the frontal lobe and temporal lobe of the brain to respond further according to their own knowledge, experience and thinking patterns, and transmit it from the brain stem to different effectors to respond. These reactions can be not, tit for tat, unreasonable, or happiness, fear, or sadness, depression.
Part 2. What are the symptoms of depression?
The symptoms of depression range from mild to severe. At its mildest, you may simply feel persistently low in spirit, while severe depression can make you feel suicidal, that life is no longer worth living. Most people experience feelings of stress, anxiety, or low mood during difficult times. A low mood may improve after a short period of time, rather than being a sign of depression.
Part 3. The other causes of depression.
Besides neck injury-caused vertebrae, arteries cannot supply enough blood to the brain. What are the other main causes of depression? Abuse. Physical, sexual, or emotional abuse can make you more vulnerable to depression later in life. Age. People who are at higher risk of depression. Menopause. Certain medications. Conflict. Death or a loss. Gender. Genes. Major.
Part 4. Help depression by doing some changes of your life.
Many people with depression benefit by making lifestyle changes, such as getting more exercise, cutting down on alcohol, giving up smoking and eating healthily. Reading a self-help book or joining a support group are also worthwhile. They can help you gain a better understanding about what causes you to feel depressed. Sharing your experiences with others in a similar situation can also be very supportive.
Part 5. Treatment of depression.
3.2% of children aged 3-17, approximately 1.9 million, have been diagnosed with depression, 7.1% of children aged 3-17, approximately 44,000, have been diagnosed with anxiety. So we need to diagnose this depression as early as possible. And medical treatments. Treatment for depression can involve a combination of lifestyle changes, talking therapies and medication. Your recommended treatment will be based on whether you have mild, moderate or severe depression. If you have mild depression, your doctor may suggest waiting to see whether it improves on its own, while monitoring your progress. This is known as watchful waiting. They may also suggest lifestyle measures such as exercise and self-help groups. Talking therapies, such as cognitive behavioral therapy, CBT, are often used for mild depression. THAT is not improving, or moderate depression. Antidepressants are also sometimes prescribed. For moderate to severe depression, a combination of talking therapy and antidepressants is often recommended. If you have severe depression, you may be referred to a specialist mental health team for intensive specialist talking treatments and prescribed medicine.
Part 6. How does Chinese medicine treat depression?
The treatment of depression by traditional Chinese medicine is targeted and individualized under the guidance of syndrome differentiation, including traditional Chinese medicine decoction, acupuncture, electric acupuncture, cupping, ear acupuncture, kigging, etc. Patients who can take traditional Chinese medicine can choose traditional Chinese medicine decoction or proprietary Chinese medicine. Patients who are not suitable for taking medicine, such as women breastfeeding after childbirth, etc., can choose non-pharmaceutical treatment, such as acupuncture, canning, ear acupuncture, etc.
According to different syndrome and symptoms, different herbs, acupuncture, and cupping treatment will be described and can have a very good result. Part 7. Using Dr. Zhao neck Tuina techniques.
After 30 years treatment experiences, constant studying and researching, Dr. Zhao has found proper neck Tuina is a very important treatment method for depression patients. He has treated both adults and children, achieved very good results. His idea is based on what he feels from patients' neck, the closed spaces between the vertebrae, tight ligaments and muscles, the limited movements, all have great compact to the brain's blood circulation. So after few sessions of Tuina treatments, patients feel great benefits from it. Dr. greatly recommended all depression patients should have some proper neck Tuina treatment.
At last, let's see a case study. Hello, Emily.
Hello.
So you are newly graduated university student.
Yes, correct.
And so you have a good job now.
Yeah.
Lovely. Okay. So can you you are pretty girl, beautiful, tall, and lovely. All right, you're poor one. And can you please tell me about your story about anxiety?
Yes, of course. I've had anxiety since I was about 15, 16. I was having panic attacks about 6 times a day at one point. It was actually, have a big burden on my life. It was actually quite horrible. And then feeling very stressed, I was starting to have very negative impacts, influences on my body. I was starting to feel quite ill, quite weak with anxiety and stress. And then I came to Dr. Zhao, and then he treated me for it. And the panic attacks, after the first session, I was having hardly any panic attacks. They were greatly reduced, and then after a couple of sessions, anxiety was gone. And I don't really suffer from any panic attacks now.
Right, that's very good.
Yeah, I don't really.
So that's because
any.
your friend, your mom's friend recommended you.
Yes.
Yeah, your mom's friend because you were suffering and she saw you suffering, and especially before your graduation, you have exams. Quite a few exams, and that makes things worse, isn't it?
Yeah.
And then after you had one session, you feel better.
A lot better.
Yeah, and then after altogether, probably we did 6 sessions. And you told me, I'm amazing. I said, you could have 1 or 2, but now you said no, you didn't have any.
No, I don't really I was getting them a lot then, and I don't get them anymore. Okay. And I went to the doctors and they gave me pills, but I didn't really want to rely on pills.
No.
So yeah.
You feel good now?
I felt great, yeah.
Yeah, okay, lovely. And this time is 2 weeks ago, 2 or 3 weeks ago, you said your jaw is locked.
Yeah.
And you hardly to move 1 or 2 fingers in your jaw, and it's very painful, isn't it?
Yeah, it was very, very painful.
And difficult to chewing or difficult to eat.
Yeah.
And also even when you talk, probably it hurts, isn't it?
Yeah.
Yeah, when you talk, it's a laugh or something.
Yeah, it was really painful.
Yeah, and also I explained you the same problem is from your neck, isn't it?
Yeah.
And I did very hard, painful pain treatment, make you almost cry, isn't it?
Yeah, it was
cry.
painful.
But now, after 3 sessions, today is the 3rd session, and you feel better?
Yeah, there's no pain. I can open it a lot wider.
Okay, so can you show me your... Yeah, and not painful?
Not painful, no.
Okay. Yeah, before it was painful, isn't it?
Very painful. Could barely open it at all.
Yeah, okay, right, good. So, very good example showing we do the right thing to treat the neck, treat the nerves, treat the blood vessel to your brain, and then make everything better. Yeah. And this is a new treatment, to be honest. Not so many people knew about it.
No.
And then even I treat few, but still not big enough, the figures,
Not
maybe
widely
thousand,
known,
thousand,
no.
yeah. So then they can say, oh, this is a great treatment. This should be used for everybody.
Yeah.
But for your case, I want to show people this is works, all right? And for anxiety and for your jaw problem, it works very well, okay?
Yeah,
So after another few sessions, your jaw should be normal, okay?
No, great,
Yeah.
great. Thank
Okay.
you so much.
Thank you. Okay, thank you for your talking. Okay.
Thank
Nice.
you.
Okay. Okay. Bye.